As many of you know, the ultimate goal of the Borah Symposium and Foundation is to provide a forum in which we may discuss not only the causes of war, but also the conditions necessary to create a lasting peace. In this effort, we find it fitting to conclude the 2009 Borah Symposium with a panel discussion. By bringing together three of the foremost experts in the field of global health, I believe that we will have achieved an important step in reaching those goals set by Senator Borah so many years ago. And now to our guests. The three experts that we have invited to participate in this discussion each have served in a unique capacity in the field of global health and bring to the table a variety of rich experiences and opinions on tonight's topic, strengthening systems for health. Dr. Jose Teruel has been involved with global health issues since the early 1970s when he joined the Pan American Health Organization, serving as the regional advisor for Central America. While at PAHO, Dr. Teruel was a leading individual in developing and coordinating their strategy of Health a Bridge for Peace. Currently, he's an associate professor of global health and international affairs at Georgetown University. Dr. Marie Nguyen's expertise in assessing and dealing with the psychosocial impact of crises has taken her to numerous conflicts and disaster locations, such as Chernobyl, Palestine, Sri Lanka, and Algeria. In these and other areas, Dr. Nguyen has worked with multiple NGOs and UN organizations to meet the psychological and mental health needs of communities recovering from disaster. Currently, she's an associate professor of sociology at the University of Nantes in France. John Hassel has served for the last 2 years as the Washington Director for the United Nations Joint Program on HIV/AIDS, also known as UNAIDS. His expertise in providing advocacy for those suffering from HIV/AIDS to the public policy community in Washington. Mr. Hassel also works with the private sector and media for UNAIDS advocacy, providing educational and technical expertise on the AIDS pandemic. So, the format for tonight's panel discussion will be fairly simple. First, we will begin with short opening presentations from each of our guests, and then we will move into a question and answer section open to the audience. At the end of the evening, we will close with short final statements from each of our guests. So thank you very much, and now let's welcome our panel. First, I believe we'll have a presentation from Dr. Teruel, then we'll move on to Dr. Nguyen, and then John Hassel. Thank you.
Good evening. Thank you very much for coming to this last session. It was a pleasure to be here with your other colleagues discussing this subject on building health, building peace. I brought a figure of cherry blossoms from Washington, D.C. So you people are expecting the springtime coming soon here too. And although I'm working with Georgetown University, I came here to represent this lady that is the director of the Pan American Health Organization, a building, the headquarters in Washington, D.C., and she sent regards to the department, to the university, to the organizer of this event, and invite any one of you that any time passing through Washington to stop by and to visit the headquarters of the oldest international health organization working in continuity for the health of the people in the American continent. This is just across the State Department, so it's very easy, the direction to get there. We had, in the previous presentation in these 2 days, that from the beginning of the symposium, many references to the issues that we are going to try to summarize tonight. I have to set some example in terms of time for my colleagues also. But one of the issues that have been mentioned were the Millennium Goals. That is a kind of a guide for international organizations. John Russo mentioned this today. And just to call your attention that all the items that are in this list of goals, starting with the one that is poverty, are all there, all of them, important for the well-being and what we understand as the health of the people. So the most important problem that was left from the last century is poverty. And this is the first goal in the Millennium Goal, and we hope that we keep in mind that we have to reduce this in order to reduce conflicts, also to improve the health and well-being of the people. In the Program for Health People 2010 of the United States, there is a reference to the health determinants. I just brought here this graphic very quickly to remind that health that is in the center of the health and well-being that is in the center of this graphic. I don't know if you can see my pointer here, is influenced by so many factors that are summarized here in the little boxes. We tended just to concentrate in the health system that is in the left corner there, but also employment, work, housing, social organization of the society, education, personal facts, all them are interconnected in order to produce what we understand as health and the well-being of the people. I found this mural in Bolivia some time ago, and the painter was trying to transmit the same message that is in the graphic that you saw before. All the elements that are connected in the human being in order to produce well-being and health. And you can see that half of this paint on the right side is referring to peace, the end of war and peace. And the other side, we have food, protection, healthcare, education, represented in the figures that are there. So you see how we, bureaucrats, we represent things, and how an artist represent the same aspects there. I believe that he succeeds much faster than us in order to transmit the ideas that we intend. Reference, in many ways, people that work in the health field can collaborate in order to produce peace or to contribute to the process of building up peace. We developed in Central America what we denominate health a bridge for peace after so many conflicts that exist in that area that were affecting all the countries in that isthmus. Many people displaced, refugees inside that little piece of area, and settlements for refugees, and creating a situation that will affect the lives of the people, millions of people in that area. The idea was to work together with the countries, with the authorities, with the Ministry of Health, but trying to call their attention about the problems that were affecting their lives. More than 600 meetings in a few years have been organized, trying to put together people that were in different countries, that were having conflicts in the borders, and we succeeded little by little to get political support, go to the international agents, collect resources, and here just a representation very quickly. I can speak 2 hours about this, but the little flags showing the different proposal programs that the different countries have been supporting at that time in the 80s. We visit the countries, we get inside, we use the machines that before have been used for war in order to start looking for the people that have been suffering different diseases there. We have been able to reach to a point where the presidents of the 5 main countries in Central America start meeting and start signing agreements, like the one in Esquipulas in Guatemala in 1985. 2 of them are presidents again at this time. That is Oscar Arias in Costa Rica and Daniel Ortega in Nicaragua. Symbolically, we have been able to demilitarize. We had the Contras supported by the United States fight against the Sandinistas in Nicaragua. That was stopped later on. There was a decision by the Congress of the United States to stop supporting the Contras. And we have been able to demilitarize. People buried the rifles, maybe the old ones, but they buried some of them. And we transformed what have been previously guerrillas or movements, called also terrorists, in political movements, political parties competing in the elections. They had the conditions to do that, took time, not being afraid to go to the towns and to start discussing dialogue in order to produce the process where they could also participate in the democratic process of election. Took some time. Just one of these groups have been able to be elected recently in El Salvador. So, no war. Boutros-Ghali in 1992, in the United Nations, not the nations, developed what was called the Agenda for Peace, and looking for the mechanisms to produce peace there. That is summarized here. When I was invited to come here, I started looking for some information to understand who was Borah, because I didn't hear very much before. And I found among the things that I read some remarks made by President Bush last year, trying to criticize the intentions that was interpreted from President Obama to start a dialogue with countries and government that was understood to be maybe enemies or kind of a threat to the United States. And he made a reference to an unnamed senator who said, Lord, if I only could have talked to Hitler, all of this might have been avoided, with reference to the Second World War. Anyway, this idea that implies that dialogue is so important that maybe we should try to avoid the conflicts. Again, the cherry blossoms of the Washington, D.C. This was a gift by Japan in 1902, 1909. I can read what is in there. I started thinking at that time, if at the beginning of last century, Japan was giving a gift to the United States, why? In a short period of time, 40 years, we got a war, we got atomic bombs, and the country became an enemy. This country now is a friend again. So we go to a process in our lifetime where a friend becomes enemy, there is a war, they become a friend again. We should have avoided to go to this stage of war, killing people, and so much suffering. Vietnam War could have been avoided, I think. They are friends now. Iraq. When I saw this picture, for the Arabs, to throw a shoe or to use the sandals is the most offensive thing that they can do to something. But you can see the disproportion between the things that are in the picture there. Anyway, Iraq. Soldiers suffering because they see the suffering when they are there. And they also have mutilations. They have been killed in high numbers. All this could be avoided. I think there is time for dialogue. We have to insist on this and to make more analysis from the previous experience and lessons from the past so we can learn and can use things for the future. And we believe the health and what we can do in health can help in that sense. Soldiers, children soldiers. Well, imagine a world where children could play without being afraid of war. Thank you very much.
Okay, next I believe we'll have a presentation by Dr. Nguyi.
Je vois rien. I will briefly talk to you tonight about my recent experience in Central African Republic and use it as an example illustrating the complexity and necessity of the question of peace through health. The mission was to implement a health program and a psychosocial program for vulnerable and displaced population, comprising also the situation of children soldiers demobilized. This implementation was in the north of Central African Republic, the province of Rakaga, between Chad and Sudan. This region is is isolated during 4 months out of the year during the rainy season. It is very politically unstable because of ethnic conflicts. Central African Republic is a very poor country suffering from conflicts since many years. It is a society without infrastructure, without roads, electricity, schools, hospitals, and so on. The NGO Medical Aid Committee built some health centers and providing training for midwives. But building a health center, training midwife, is it enough? When a woman, this one, has to ride on her husband's bicycle handlebar in order to get her to the health center because she's in labor, it become apparently that having built this health center and having trained these midwives is not sufficient. We need roads, cars, and women education. In order to implement those broad changes, negotiations are necessary. We have to speak with the chief of the community. We also have to evaluate children's needs. They like to express themselves drawing, and I ask them to draw their house. The displaced children drew their whole house before it was burned by the rebels. The NGO built a community center, and we can see that one of the activities is sewing. For the women, it is an opportunity to talk, and we organize with them trainings on gender issues. The road to peace goes through health, but the way we define health has to account for the complexity of individual situations and includes mental health, education, women issues, human rights, and development. It's all.
And now John Hassel.
I can't see a thing up here. But first I have to say how much I've enjoyed my visit. I've been to Idaho a couple other times in other capacities. But I have to say, I said this earlier, I apologize if those of you are hearing it for a second time, but I want to thank our hosts and I want to thank the community around the University of Idaho. You could be doing many other things this evening, but your interest and curiosity in our work is well appreciated. I thank you for your interest. I want to just quickly go through a couple of points, and I'm really anxious to hear what's on your mind and to hear your questions. But I want to show you a couple of pictures. There's two, right? Okay. I was in Tanzania in February, and part of my work in Washington is to educate policymakers. And a lot of the times the policymakers aren't the ones that you see on television, they're the staff. So I took 8 congressional staff, Republicans and Democrats, staff to the members of the Senate and members of the House of Representatives, who advise on global health issues. And many of them are in their 20s and 30s, so haven't been around the world yet. But advise their principals on public health issues. So I wanted to show them the Kuwaiti project right here. This is a project, these young women, I don't know if you can see them too well, I took the picture myself. There are about 70 girls in this picture. Not all of them fit in the picture though, but they have been rescued from child trafficking situations. Many of them are less than, or most of them are under 18, who have experienced AIDS in the way that they've lost a parent. And in one particular young woman's case, her father died of AIDS, her mother remarried, she was kicked out of the house, and had to live on the streets. And that meant that she had to provide or sell her sexual favors in order to get food. And she stood up and told her story quite bravely and in public. And it really touched the lives of the 8, and they were all women, the staff that the UN arranged to come over there. This is an example of the United States government and multilateral programs such as the International Labor Organization, the ILO, and the World Food Program working together. And you might think, oh, well, that's really nice, you were able to do that. But these women stood up and looked me in the eye and said, now that you know our story, what are you going to do about it? How can you get us into schools so that we don't have to live on the streets? And how can you go back to your country, which they consider to be quite wealthy, and it is, so that we can have a better life here in our own country? Well, we really didn't have much of an answer. I mean, I did respond, but that's what my work is about. May I have the next slide? I have to do it. Okay. You got it? How's that work? Voila? No? Ah, there we go. This is in Zanzibar, which is a little island outside on the Indian Ocean. Here we have, I don't know if you see the woman who is covered with the yellow scarf. She's what we would call a foster mother. And all the children there are the children in her village that she's taking care of, and they are orphans. And as you know, many of you know about these things, that orphanages are sort of passé because the evidence has shown that the educational outcomes aren't very satisfactory for kids that stay in orphans more than 2 years. And so UNICEF in Zanzibar works with the local community. As Marie-Therese says, you have to go to the chief of the village to get permission to do these things. And we've learned, in order to be culturally competent in the AIDS response, to find out who the mothers are that are willing to do this. And she's receiving a subsidy to take care of about 8 kids in a house that has only a dirt floor and outdoor plumbing. So I just want to quickly wrap it up. AIDS isn't over. There is no silver bullet in the AIDS response. It's a complicated problem and requires a comprehensive approach. We have to address not only orphans, there are 19 million orphans in sub-Saharan Africa. We have to address violence against women. And yet it isn't all doom and gloom. Since about 2001, we had about 200,000 or 50,000 people in Africa on antiretroviral treatment. Now we have worldwide nearly 4 million. And we're steadily increasing and making life-saving treatment available to millions of people. The AIDS response is strengthening other systems. And we're going to get into that discussion, I hope, where we connect what Jose has said and what Marie-Therese has said so that we can all really have some kind of interconnected discussion on this. We've learned that in Rwanda, for example, there's been a 21% decrease in hospital admissions because of the introduction of expanded antiretroviral therapy in that country. So I want to challenge you. A lot of you probably think, well, these are really serious problems, but I can't do much about it in Moscow. You can do a lot. You first of all are here tonight, you're becoming more aware, and you can become engaged. This week, the United States Senate restored budget cuts to the foreign assistance budget resolution, so that's progress. Those are the kinds of things that I worry about. And you can, through the democratic process here in the United States, and I can't interfere in the domestic affairs of a member state, but I can encourage you to become informed and pay attention to these kinds of details. Because the United States, and I have to say this every time I speak to an American audience, the United States is so important in the leadership in the AIDS response and also in the response to building up health systems. So if we get the United States committed, the rest of the world will follow. Thank you very much.
Thank you, panelists, for those good opening remarks. Before we move on to the open audience question and answer session, where the panelists will get an opportunity to discuss, just want to let you know that as we were planning this discussion, they were all very adamant that they wanted the audience to be involved, and they're looking forward to hearing your probing questions. So do we still have the microphones at the side? Okay. All right.
Can we have some lights in the audience?
Yeah, if we could get lights on the microphones, that would be good. So anybody who'd like to ask a question, feel free to go up and ask.
Yeah.
Okay, this is a complicated question, but it's a complicated issue, so. Well, basically what it comes down to, this question has been sort of percolating over the last couple days, and it's impossible to answer, but I'd like to hear what you think about it. What Marie-Therese was saying about the lack of infrastructure, for example, in the Central African Republic, and I can't think of any more examples right now, but it makes me think, like, how much are we imposing Western conceptions of health? Like, I just wonder what the negotiation is between native conceptions of what health means and what, like, a Western scientific viewpoint of even something like mental health, for example. Is there a universal set of criteria, or is that what you just have to work with because it's better than what's happening in a rapidly globalizing world? Yeah, I think, does that give you enough to, okay.
You want to take a couple more?
We've heard a lot about the ties between education and health over the past few days. I was wondering if you guys would expand a little bit about how important those two ties are and what needs to be done.
All right. Should I go first, or do you want to go? Yeah? You go. Okay. Well, I'm probably the least qualified to answer the question, so I'll go for it. We had a question about the Western conceptions of health and the connections between education and health. You can't apply what we have, standards of health care in, for example, the United States, to the situations that we face in resource-poor settings. For example, if you take a look at the healthcare workforce, when you and I are sick or you and I need to go in and get medical care, we're greeted with maybe a receptionist and then a nurse that will look us over, and then and I know in my situation, I can talk about my own. I had knee surgery, so someone sees you for one exam, and then you come in, and then you get 5 minutes with the orthopedic surgeon, and he rushes out to another appointment. Well, in the case where Africa has 25% of the disease burden and maybe 1 or 2% of the healthcare workforce, the global healthcare workforce. You can't. That's just impossible. So the healthcare professionals are now working on what's called task shifting to train and increase the training so that volunteers can become, semi-professional about all of that, and nurses can eventually become qualified to dispense medicine. But I still want to come back to your example where I was visiting Soweto, and I think stories are always just as important as the theory. And we were in Soweto with a U.S.-funded program to encourage testing. There was a mobile unit that had the professionals in it, and it was basically like a little Winnebago that moved around in the community, and it encouraged people to come and get tested. But wandering around in the village, or in Soweto, which is not a village really, it's 1 million people, was what you and I would call witch doctor, or what they would call a native healer. And what we've learned is that you can't suddenly tell a community, stop going to this person over here. You have to educate the native healer about fundamental things like universal precautions. And universal precautions, for those of you in the medical business, is making sure that you're protecting yourself with gloves if you're in contact with body fluids and so forth, so that you don't inadvertently cause harm. And you don't send in someone who's white like me and blue-eyed and talk to the native healer. You use the locals to do that. And so what we've learned is that if you integrate that, it works much better, and you get the buy-in of the community. As Marie-Therese said before, and she showed you up there, you have the chief of the village backing you up. And if you have that backing, you can be a lot more effective in mental health situations or psychosocial situations. And so that, I hope, addresses your question. The question about education and health is vital. I showed you the picture of the young women in Tanzania. It would break your heart. It would break your heart. I mean, they have money in the government budget to get them through primary education, but they have no money for secondary education. So right when the sap starts to rise, so to speak, right when the women become adolescents, right when they're frankly the most sexually vulnerable, they're put out on the streets, or they're sent into homes to be domestic help, where they're taken advantage of. And so, in a country of 325 annual per capita income, a $10 school fee can prohibit young women from getting an education. And so I don't have the answer to that, to whoever said the question, but that's why one of the Millennium Development Goals is universal elementary and secondary education.
Okay. For children, we work with human rights and the rights of the children, the Convention of the Children. So when they were in a country, some children soldiers, it's a problem for us. And health is a good manner to work with them. There is many difficulties also with the community, and you can see we have to have meetings with the chiefs, with the women, with the families. And we have to work when they can say what are their needs. But they are like us. They want to welfare also, well-being, and we have to improve the life, the ordinary life. but we have also to build some community centers, some health centers, and the progress are very slow. But the principles are human rights.
You can see that with the two provocations from the plenary, we can talk and we can expand this and to have further presentation. But that it shows that's the areas that you might have interest. About infrastructure. Some time ago, the United Nations Program for Development, the UNDP, made an estimate, say how much it would cost if we decide to provide basic nutrition, elementary education, and basic health care to all the people in the planet that don't have it, that you know is more or less half of the people that lives in the planet don't have it. And they came out with a number that was about $12 billion a year. Okay? Another estimate that was made was, how much do we spend in the food that in the developed countries or throughout the planet that we give to pets? It came out that was $15 billion a year. How much we spend in cosmetics, females and males, men and women, everybody use it, is about the same amount. How much we spend in cookies, chocolate, and so on, in the places where we can have it. And we came out more or less with the similar figures. And when I talk about these numbers with my students, I say, well, wait, I don't want everybody to leave the room now feeling guilt because they have a pet at home or they use a cosmetic because they like cookies and chocolate and ice cream. So the question is, suppose that Mr. Gates, Bill Gates and Melinda Gates were sitting here, and they hear that calculation, wow, I have the money. I'll give you the $12 billion. You and the people that are here now, go there and solve this problem. We will be in big trouble, right? Because the problem of infrastructure. I say, how much time we need? Because we can have that resource. But if we go to the areas where people are starving, don't have enough food, don't have education, don't have health care, we have to train the teachers, we have to build up the schools, we have to organize civic organizations, we have to build up health centers, the healthcare system, and so on. So it's not a matter only to make numbers and calculation like that. It gives us the dimension of values, costs, and how much we are behind if we want to have a more fair, a more just kind of life inside the planet. So we have to find out mechanism to go to that. Let me stop here now because I think we want more questions, right?
Do we have any more questions from the audience?
A couple more.
Hi, excuse me. My name is Jeff Hickey. I'm from the University of Idaho. Thanks for visiting Moscow. We appreciate you taking time out of your schedules to come and talk with us. My question is about your views on the Obama administration. So two parts. One is how they're doing so far with respect to health and peace. And then what would you tell President Obama or his administration about modifications that, what sort of policy changes would you suggest to make some, say, achievable impacts within the next few years? And just to make it a little harder, maybe say that, of course, maybe within a reasonable budget constraints. I mean, given today's budgetary environment, you're not going to be asking for that $15 billion, for instance. But are there small things that President Obama could be doing in the next few years that might make some real progress?
Yes, hi. Also, I'd also like to thank you for coming to Idaho. We all appreciate it a lot. But my question, I'm been studying development a little bit while I've been at the university here, and an issue that comes up a lot is how developing nations are often dependent on the Western world, and I think that's really an issue. That's something I'm just thinking about with health. Now it seems that developing countries are indeed dependent for drugs and for funding, and then I guess diplomacy in a lot of ways. I'm wondering if well, again, just to say, in my mind, I think it seems to me that the best solution in the long run is that developing countries could be independent, and I'm just wondering if you see that as at all possible, like in our time, if that's something that's possible.
I could start on this side now, but although, let's say, a question about Obama administration would be much better someone from the country to answer. But just a few ideas, a few thoughts about it. Start from the second point, maybe. The question of dependence. And we have to think about lifestyles also, not only what we produce in the developed side of the countries. There is another estimates made now by the School of Administration of the Harvard University. I think you have seen already what they call the footprint in the planet. I believe some of you have seen that figure already. It was a drawing of a footprint. You see, what is the size of a footprint from each one of us? And that was a calculation made. See, if we have been able to measure how much is necessary, what we use during our lifetime, from the moment we are born until we die, we eat, we use energy and the paper, everything, let's say, to live and to participate. If we transform this calculation in a size of land, and it becomes, depending how the way you live is the size of the land that you need to produce what you are going to use in your life. And this is a comparison that was made between countries. So the figure is footprints from the United States, from the Netherlands, from India, and so on. And it's getting smaller. So you go to places where what people use to live is so little. Maybe they deserve more. And when we go to outside of the developed countries, the way we live, what we use, the calculation came out to the following conclusion. If every person that lives today in the planet uses and lives the same way we live in the developed side, in developed countries, we need 3 Earth planets to produce that. Let's say it means it's going to be impossible to get a development, that is the point you are asking for, where everybody is going to have the kind of life that we have now. Let's say, what can we do? Let's say, we have to find forms of energy. We have maybe to find a way to live a more simpler. And there is a statement that says, you have to learn to live simpler so others simply can live. It's the imbalance between the use of the planet and the future. That comes to the environment and the question of sustainable development that Dr. Brundtland mentioned yesterday. But she has other things that she wrote about it. The idea of sustainability for development means we are going to develop, but we are considering generations coming after. Otherwise, we can exploit the planet in a way that's going to be impossible to have life later on. Exaggerate a little bit. Let's say there is a question like that. And so styles of life and dependence. I stop here for my colleagues also to react.
The question on the development is very important for the humanitarian people. Because when we do something, we ask us, is it a good or a bad thing? we want to work for the autonomy and not for the dependence. When we put on a program, for example, an educational one, is to permit to the young people to progress and to be independent in 10 years, to help them to construct, to build a world where they can have some good things to do. We never work for the dependence.
Well, the UN is never supposed to interfere in the domestic affairs of a member state, so I'm going to get in trouble by answering this question about what to tell Obama. So turn off the tape recorder. I think the president is doing the right things. You read the same newspapers I read and the same news programs. That it's very difficult just to stand up a new team to a point. I mean, literally, the offices are cleared out. All the political, just 2,000 political appointed jobs there that basically carry out the president's policies. They're vacant. We know that the Treasury Secretary doesn't have key deputies in place yet. We don't have a cabinet secretary for the Health and Human Services Department, which has a huge global health function that serves the United States interests. So even if he had all that in place, I would say the first thing to you, Mr. President, is keep your commitments. And keep the commitments not only that you made during the campaign, but keep the commitments the United States government has already agreed to. I know we've had budget difficulties, and I think everyone understands that some of those commitments are going to have to be delayed or put out further into the future. But I still think they're solid ones, and I would look for some of the quick wins that don't cost anything right off the bat, and I think his instincts are pretty solid. I think, first of all, he's signed an executive order having to do with family planning, allowing basically canceling the gag rule that prohibited the United States from giving money to any organization that had any counseling services for women on reproductive health. That doesn't mean the United States can continue to withhold money for abortion services, but it can fund other parts of an organization that does that. Now that gag rule has been lifted, and I think it will definitely improve the lives of women across the world, and as far as that goes. Whatever you think about abortion, you know, I'm not even going to go there tonight, but it is still a fundamental issue that, particularly in my business, in the AIDS business, if a woman is HIV positive, she needs to be able to have the information so that she can deliver a healthy baby if she wants to have a child. And now we're free to, you know, have that kind of fund that kind of a policy. The next thing the president can do is lift the ban on prohibiting someone who's HIV positive from entering the country. It's already been changed in law. The bureaucracy still needs to work that up. So that's another really quick win, because it sounds like, you know, okay, this is sort of a minor issue, but it isn't, because we're addressing stigma. If no one gets thrown out of their house or loses their job or gets beaten up by their spouse because they have diabetes, they do if they have HIV, and it still is happening at an unacceptable level in this world. And that's, again, another place where the United States can lead and show the other 60 countries that have that policy that it's a good way to go. As far as actual funding decisions go, I am really concerned that we all need to better understand what's in our foreign assistance budget. Most of it goes to Israel and Egypt, for good reason. It's part of stabilizing a situation that is very dire. But we have to understand we're never going to ask Israel or Egypt, okay, in 5 years you're going to get cut off. I have a feeling it's going to be it's going to be an indefinite commitment that this country, it's a principle that the United States has, is to protect Israel's interest. I'm not debating it one way or the other. You can come down on either side of that, but the reality is the United States will probably stand with Israel for the indefinite future, and Egypt, and other countries that are trying to pursue peace in the Middle East. As far as the problem of developing nations being dependent on developed nations, you've hit a real difficult question. If you're president of a country that is relying on another country to pay for antiretroviral treatment, 85% of the AIDS response in Tanzania is paid for by the United States government or the Global Fund to fight AIDS, TB, and malaria, which is 1/3 supported by the United States. You're almost, I mean, that is a difficult situation. So what happens one day if the American public, because we have democratic processes here, makes a policy change that we're not going to do that anymore? That could seriously destabilize a whole region of the world. So what I'd say to President Obama is go to China, go to some of these oil-producing countries, go to Russia, and say, match us. Where's your money? And you know, we have lots of items on our agenda for some of these other countries. But I would say to the president to recruit some serious financial partners so that the United States is not dependent, or countries aren't dependent. It's like financial management of your retirement fund. And probably many of you aren't thinking about retirement right now, but you don't put all your eggs in one basket, and you shouldn't put all your development assets in one basket either.
I cannot hesitate to make a comment also on the provocation by Jeff on President Obama. I believe he's doing things right, and I have to believe on that. I have 14 grandkids growing in the United States. I want this country to be, as John said before, it is strong, it is important, influential among all other countries. But I notice also that all the phenomena that we have, the support that was provided so Obama could have been elected, I think we cannot just sit down and to wait what Obama is going to do. It's not fair. He's one person. It depends that the support that he received while he was throwing ideas, announcing his candidacy, and trying to reach the point he reached remains strong. And if he started doing something different because pressures, he has lots of pressures from different sides. And if we are able to give a good pressure to the right direction, we have to keep it, not to let him only in the hands of people that are looking for some individual intentions, profits, without looking for the entire country or for the things that the United States can do abroad to improve the image, to recover the leading principles and values that this country has been known for so many times, and it has been damaged recently. I think we have, and president is not one person, it's a group of people. So it's important to keep watching, it's important to keep participating in all the organizations that we have, to have discussions like this one too. And I think I have to thank you for raising the question here.
Okay, I have a microphone now. We have fielded questions from the audience, but now I'd like to open it up for the panelists to ask each other questions really quick. We're about 10 to 15 minutes left of discussion time. So do you have any issues you'd like to raise to each other?
Of course, yes. Where's my question? I have it for you.
I have one, while he looks for that.
Okay.
Okay, I got it. I found it now. Okay, fire away.
John has, he presented to us, I think, a very good example of important work and excellent participation of the United States towards a disease that is creating a tremendous difficulty in public health. And relate this with a question that was put here also. In the past, the public health we used to devise what we believe that people should do, we organize our healthcare system, our health centers, and if they don't come, if the mother is not bringing the child for vaccination and so on, we say ignorance. They should do this. This is the right thing to do. We learned that the other factors, cultural factors, are involved in that. Now we have a disease, AIDS, that I think people working in public health, including myself, we have been mistaken. We thought that was going to be controlled very easy in the beginning, and we just finished eradication of smallpox. We're looking measles and poliomyelitis, etc. And we waste a very important time. And now we have this. It's still very difficult to control. And so my question to John is how he sees the activity towards one disease in relation with the other factors that affect the health of people. How to contribute to, let's say, to help us to build up the health system that they need.
Thank you, Professor. It's interesting. The professor asked the student the question. I feel like I'm back in the classroom. Well, I think the lessons we've learned, the lessons we've learned about the AIDS response is most of the effective means for responding to it have occurred outside of the health sector. And this, for the theorists around who study AIDS and development, this is called AIDS exceptionalism. That you need an exceptional response, you need to engage the private sector, you need to engage schools, you need to engage social workers, you need to engage sex educators, you need to engage domestic violence counselors, you need to engage systems that take care of orphans. And many of those are not found in hospitals, they're not found in the health sector itself. So, that still doesn't answer your question. We all know that. You of course, have to talk to lots of different elements in the community to address AIDS, to really stop the prevention. And I should say that for every, I think the figure is, for every 2 people we put on treatment in the world, 4 more get infected, newly infected. So we're losing that battle. So how do we really get at that prevention response? So what we need to do is, instead of looking at a hospital and thinking, okay, we need to have more rubber gloves, we need to have more soap, we need to have more nurses, we need to have more training. Instead, we look at systems that strengthen health. We look at legal systems, like I said earlier about our immigration policies. We look at, I happen to be gay. I can be arrested and put in jail for 7 years in certain countries in Africa. It's a good thing I have diplomatic immunity when I go to some countries. Thank you. For those legal treaties that go back and forth. But those are, that is completely outside of the health sector. And if you criminalize certain groups, you know that as a public health professional, they'll go underground. And then you can't reach them. You can't talk to them about prevention. You can't talk to them about how to protect themselves from an HIV infection. So the lessons we learned around an AIDS response is that you have to engage the entire community. And I'm saying something that's almost intuitive. We all know this in our guts. We know that, as the Prime Minister said earlier today, all these systems connect to each other. It's like the lesson of the environment. We cannot deal with it in just one vacuum and say, okay, I'm going to treat HIV if you're positive, and I'm going to then tell you how not to get infected, and then ignore completely the environment that you're living in, whether you happen to be a drug user or that those poor girls that they're kicked out on the street and suddenly they only have one option to get food on their table. So we have to take a holistic, so in that particular case, we needed to strengthen the public, the secondary schools in Tanzania. So I hope that answers the question, Professor.
Okay, I don't know if Maria Teresa wants to comment on that.
On your question?
Let's say in terms of broad involvement when we are dealing with the programming in the country. If you want, if not, it's okay.
No. No, I don't.
Okay.
Do you have any other questions on the panel?
Yeah, I found mine. Jose, In what ways can improving health systems strengthen progress towards building conditions for peace?
Oh, all right. We know, let's say, from history and from movies, maybe sometimes some books, and the Red Cross in the Symposium, Neil, Dr. Aria, he showed the picture of Henri Dunant, that was the first Nobel Prize and the founder of the Red Cross. He said, we remember that Red Cross acting with the doctors, getting ceasefires in wars and treating the people that has been hurted and abandoned there. So the idea of having health people, nurses, and famous ones that has been acting during situations of conflict is well known. And I think that's important, it should be done. And usually in the logistics of any war, people think about the hospitals that are there. United States is not, when any war like the present wars are going on, behind the soldiers there is lots of professionals and people in the hospitals that are taken together in terms of providing support for people that get hurt. You know that the data that we have, like Iraq war, 4,000 soldiers dead, 30,000 hurted, plus the civilians. I say the number of people mutilated and hurt is very. So this area is well known. I think is one example that is very important, and we have recognized these people that are working in very hard conditions. But we are trying to go towards the other things. Let's say before the conflict. If the activities that if we know something is escalating and it's possible to act. I gave you the example of what we did in Central America. That was a mixture. 7 different countries in different situations, but confrontation between them inside the countries. Each case is a different case. So it's possible there also. Boutros Ghali, in that document I mentioned in the presentation, the Agenda for Peace, he was talking about, I made a note here, peace building, peacemaking, and peacekeeping. He used these 3 expressions to say, okay, we can help building the peace and the health, education, activities, development, support, etc. Help in that. Peacemaking, when some conflict already exists, and intervening, try to talk. If a third party, a stronger country, comes in between and is able to dialogue with both sides and make them to rationalize things. The United States have played this role many times before. And I feel sorry when I see the country involved in a war. I would prefer the country being the intermediate, solving these things. And the other is peacekeeping. After you are able to diffuse that, if you go immediately with some help for development of infrastructure, education, schools. And the American people has so good heart, willing to go and to help and to participate in this, that I mentioned this one of these days, but it's an idea, it's theoretical, because the things are much more complex than what we expect they be. When I make the calculation, the amount of resources being used in a war like the war in Iraq, $200 billion, it goes going up, 700 billion, so on. This amount of money, if I use that to facilitate all the young people, like many of those that are here in this room, to go abroad, spend time in the other countries, develop countries and participating. Trained in the basic things of healthcare, because you can help there. Or the things that you already know. The image of this country would improve tremendously. And we can do a tremendous good help, much better and faster than going with showing our strength in terms of force or making a threat to other countries. I'm not answering your question, but let's say, I think there is a big range of activities that we can feed people that works in the health sector, in the different physicians, nurses, auxiliaries, technicians, all kind of people. For me, it's also another way to solve the problem of unemployment in the country. When I see there is unemployment, oh, let's train more nurses. We need more nurses. We need more auxiliaries. If we have the money, let's fill all these people that are looking for jobs. Let's train them to do something and help to the other people that needs that. I think we have to give some ideas to Obama.
Yeah. Okay. Want to ask a question?
Yes.
You want to ask me a question?
Yes, I have a question for you. About the prevention, what link can you do between AIDS prevention and peace? I can see how war develop AIDS, but in the other way.
I think the question is how can AIDS prevention build opportunities for building peace?
Yes.
Wow. Yeah, they don't ask easy ones. I think one of the biggest challenges around AIDS prevention is 85% of AIDS prevention is sexually transmitted. The rest is from drug use and other transmissions. So you really have to, if you want to look at building opportunities for peace, I think we need to start looking at the whole gender issue differently. And I'm not trying to promote some kind of feminist ideology. I'm looking at, I mean, you saw the images earlier today, the amount, and when we have wars, those that feel the pain and the suffering worse are women and children. We know that from our own history books. But I would say that as we look at AIDS prevention, and we look at how women are treated in their countries, I think we can build, if we strengthen the position of women in situations where they are not treated equally, where they're subject to abuse in the home. In some developing countries, I've heard this said in South Africa, I'm not making this up, that the most dangerous place for a woman is often in her own bedroom. And so we need to really open our eyes to these situations and what is the cause of that violence, and why, if we turn to violence to mediate disputes within a family situation, then of course using violence to mediate disputes internationally becomes less of a leap. So I know I'm sounding quite theoretical, but I think if we're really going to be serious about using AIDS prevention as a means of promoting peace, as the expression goes, we need to start in our own homes.
Okay, we can probably have just a short little bit more time of discussion. We're at about 10 minutes left, so I'd like to give you all the opportunity to finish your closing statements. But Dr. Terrell, did you have something to add to that?
No, I was going to put up more questions, but if you want to close, it's okay with me.
At the moment, I think it might be best for us to move into the closing statements so that we don't have to make them too short.
Okay. Do you want to close?
No.
No?
You want to? Yes.
I'll go last. After you.
No.
Well, first of all, I don't have anything really profound to close out with. I just want you to, I guess the best closing statement I can make is remember that the United States foreign assistance budget is less than 1% of the total U.S. spending budget. It's even though we're talking about big numbers up here, it's still small change, especially compared to some of the things we've been reading about in the news when you compare it. So I would suggest to you one website that's very bipartisan and very well informed is one.org, www.one.org. They did a great job during the presidential primary campaigns of educating voters about the importance of U.S. leadership in foreign assistance. We're not really asking for a lot of money. And it's not always about money. As I said earlier, it's about changing some policies as well. But I think if you pay attention to what's going on in Washington, you can make a lot of difference. I remember when I was at Hewlett-Packard, and I was working on, and we didn't even talk about how trade really promotes peace as well, but we were working on, we were always working on trade legislation. And Idaho, because of the sugar beet farmers, was able to really hold up the Idaho congressional delegation. Yes. And you know, Idaho has one of the smaller congressional delegations, but it had a tremendous amount of leverage and influence. And so if we could apply that same kind of power and influence around some of the questions that we talked about today, it would really do well. And so you don't have to leave your community and go to Kigali or Washington or New York. You can have a lot of influence right here in Moscow, Idaho. So I just want to thank you for being so engaged in this, and I want to thank you for your kind attention tonight.
This question of building peace through health put us in a systemic point of view. And we have seen that it's a global question. We have to work with education, with buildings and roads and infrastructures. And it's a very important way of life, I think, to put this question in the center of the human rights and all that we have to do.
Okay. This couple of days passed really fast, and it was a pleasure, the interchange that we have been able to have with so many of you there. And what I believe is that some of you are teaching, are involved in the university, others are studying. We have a role to play in the things that we have discussed. Working or teaching or training people for the future in any institution that you might work, or you're training people to go outside later on to start their life in institutions. Don't forget that you can do a lot for the other people in the entire planet. And there is one idea that I want to express in this last opportunity, that is an idea that WHO is developing now, that they call transition. It's very important humanitarian aid. When people are suffering emergencies and so on, we can do a lot. We can send donations, we can go there. But that's not enough. We have from that aid for the emergency to create the roots for development. As some of the pictures that myself, my colleagues have shown, John have shown some today, Marie-Therese also in the work she has done, showing these people that are looking for an opportunity, and John show a case, a specific case of someone asking him, and now, after that, now that you know me, and so on. There are some people that we becoming known to us, who have seen pictures, but they are representing, and I think this is what we want, all of us here. When we show some pictures, with all respect for those people that we took pictures from them, they are representing other people, a bunch of them, millions. And we can do a lot. But don't be misled only by your good heart, that some help, some hate is enough. We have to think about the ways that people could be developed. And this is what WHO is calling transition from the emergency to the development. Instead of assistance, let's do cooperation. The idea came out here in all the interventions. Use the locals, the participation of the locals. We cannot go there with a solution. We have to relay in them the way they see things, their cultural life, the historical development they have, all these together. From the point they are, we learn with them also. I think we can do a lot in the future about this. And we have a great expectation, and we are sure that this university, the way you people are doing the activities, and this symposium is an example, a good one, I think assure us of this activity that is going to be developed here. I learned very much, and I got inspired for many things that I still can do. Thank you very much for what you have done for us and this opportunity to talk to you people here.